This is Dr. Kenyon Godwin of Active Family Wellness Center bringing you Health Tip Tuesday. Today's topic is going to be the best type of health insurance to have. Last week we covered how does your insurance work, how does that work with not just calling our office but any office, and all the nuances of your deductibles and copay and co-insurance, and why it can be just so frustrating sometimes to pay out so much money and yet have such little coverage. And so today I just wanted to kind of encourage you and give you some answers, some follow-up to what can you do for you and your family, and what's the best type of health insurance to have. And the answer to that is pretty simple. The best type of health insurance to have is actually health assurance. All right? So I want you to think about it like this. Right now in America, we make up 4.4% of the world. That's it, just 4% of the world. However, we consume over 50% of all the drugs and medication in the world. We spend on average about $10,000 per person a year on healthcare, whether that's through your HSA, your health insurance, what they cover, or just through your taxes that goes towards Medicare and Medicaid. $10,000 per person. So think about that. We're spending a lot of money. We're taking most of the drugs, but yet our health status is very low. Matter of fact, of all the developed countries, we're like ranked number 37 when it comes to health. 37. We're taking all this medication. We have the most advancements, but yet we're so far behind. And that's because the way that we typically have healthcare, the way our healthcare system works, it's not really geared towards health. It's really geared towards sickness. And so we become sicker, we spend more money, and therefore, as a reflex of that, your healthcare premiums go up in cost. That's more come out of your check, less going home for your family. And yet when you call or you go to the doctor, you find out that your copays have gone up, your deductible has gone up. So it's costing you more in so many different ways. And if you don't address your health properly, if you don't take care of yourself, then you'll need to see sick care doctors and get sick care more often, which therefore raises the price out of your pocket. Even if it is just your copay or co-insurance, you're still spending that money more often. Medications cost more now than they ever did. And most people are on several medications. So you're actually costing you, your company, and the people in your family more money by not taking care of yourself. So I want you to think about something. If you're going to spend $10,000 a year on healthcare on average, and that's just you, that's not including everyone else in your household, why not invest a portion of that money towards a good gym membership, towards eating healthy, eating organic fruits and vegetables, getting good quality meat, using essential oils, getting chiropractic care to take care of your spine and your nervous system. It doesn't matter what kind of food you eat. It doesn't matter how many gym memberships you have. If your body is not able to work at its best, at its highest degree, at its full potential, you will not be able to process these things. You will not be able to reap the best benefit. And so when you see me doing these videos and educating you, it's not just for my benefit. I get adjusted. I eat a certain way. I exercise a certain way. I'm doing this for you because I don't go to the doctor that often, nor does my family. But yet we're pretty healthy. We take care of ourselves. We don't have to spend $10,000 a year on health care. We're able to put that money towards vacations and other things of quality of life. And therefore, that's why I recommend having an HSA, because you can use that as well. We don't let our health insurance dictate what we do, how we use it. And we're also not stuck. We're not looking at, oh, well, I have to make a real life decision on whether I get this care that I need, or if I just go ahead and go with what my insurance will cover and tell me to do, and get injections or something that may demineralize my bones, that may raise my blood pressure, raise my blood sugar, ultimately numbing me of my problems. So therefore today, more people in healthcare are choosing numbness over wellness. And then it's like, well, one day I just reached down to pick up a pencil and that back pain came back and I couldn't stand up. Well, it was there all the time. You just didn't know. You chose to go that route, to numb your way through life. Don't be numb, people. Take care of yourself. Take responsibility for your health. Your health is your greatest single asset. If you don't have that, it doesn't matter what you're shooting for as far as your future. It's hard to do something. I get so many people in here that they have a vacation or they have a big trip or something planned, and now they're in a lot of pain or they have a big issue and they need it fixed right away. So don't worry about health insurance if you're taking care of yourself. Health assurance is what you really need to focus on. What can I do to be healthier? What can I do to take care of myself, my family, so we don't have to be dependent on these types of doctor visits that focus on sick care, that drive up my deductibles, that drive up my premiums, and that I have to keep paying out of pocket for all these copays. Invest in yourself. You'll always get that money back. Choose health assurance over health insurance. And that way you ensure that you have a great future. This is Dr. Kenyon Godwin of Active Family Wellness Center. This has been Health Tip Tuesday.